Well, hello and welcome to today's episode of the Laser Therapy Institute podcast. My name is Dr. Jason Rountree. I'm a chiropractor and certified medical laser safety officer, and I'm joined today by Christy, who is a certified laser tech, and she's also the developer of our online training materials for doctors at Laser Therapy Institute. So, we are here today to talk about laser, obviously. And we're going to do it based off of research and publications. This is what we like to do. We like to try and bring one of the thousands of papers on laser therapy toward the forefront and make it easily understandable,
right?
Useful for providers, for healthcare providers. Yep.
Well, they're busy and you're busy too, but you do a good job of bringing the research to the front so that it can help everyone.
Well, it is hard to keep up with the research for sure, and especially if you're not just into lasers as much as I am, it's a lot less interesting probably. So hopefully we're doing the hard work for you.
Yeah.
We're breaking some of this down, making it easily digestible. You can listen to it on the way to work or whatever you want to do there on your lunch break. You know, if you're weird like me, I guess. In the gym, there's lots of good ways to catch up on some of the research on laser, and hopefully this makes it a little bit easier to understand some of the principles behind laser. Today we're talking specifically about technique, how to actually use a laser therapy device. There's actually not a lot of information in the research about how to perform the treatment.
Yeah, it's not just a matter of turning it on and putting it on the skin or whatever. There's technique and there's specific ways to make it more effective.
Absolutely.
So.
Absolutely there is. And that's exactly what this paper today is about. So we'll go into that one. Because you literally can just turn the laser on and point it at whatever hurts, and that's what a lot of people do, and there's some level of success there. It does work, thankfully.
True.
But like you said, there's a lot more effective methods to use with laser, and so we're going to talk today about a paper from 2005. Dr. Toshio Oshiro, who's an MD PhD in Japan. He put this out back in 2005. It's titled The Proximal Priority Technique, How to Maximize the Efficacy of Laser Therapy. So this isn't so much on it's not a double-blinded study or anything like that, but it's this particular doctor's personal experience in treating thousands of patients over a many year period with, at that time, the best we could find was, class 3 lasers.
Right, and it just is more effective even now with class 4. And so taking his information, I'm interested to see what he had to say. Yeah,
no, it is pretty amazing stuff that he was able to lay out here. And it really does, I think, answer well the question of, does it matter how you use your laser? Does it matter what you do, where you put that handpiece? Do the settings matter? All that is addressed fairly well in this article. This is an open access article, which means you can read the entire thing, and it's not even very long. It's only a few pages. I highly encourage you, if you've got a minute, pick up a copy, go online, grab a free copy of it, and give it a quick read. There's some really great info. I don't agree on 100% of what he says here. We know more now, as opposed, almost 20 years have gone by. We know more now. So there's a couple things that I believe are a little bit off, but a lot of this stuff is still very applicable to the laser therapists today.
Well, we'll provide a link as well, so easy access.
Absolutely. Yep, for sure. So let me give you just a few quotes from this study to kind of get us started. He says that the use of laser therapy has dramatically increased over the past decade and a half. So he's talking since 1990 in this case. And in particular, its efficacy in pain attenuation is now well recognized. Well, not so much probably in 2005, but certainly in 2023, it's much more publicized.
Right.
You've got home use devices being advertised all over the internet, and things like that are all based off of the principles of laser therapy. So maybe not in 2005, it wasn't well recognized. That's an optimistic statement, I think, but certainly now it is much more well recognized.
Right.
He goes on to say many intractable chronic pain types respond well to laser therapy, including frozen shoulder, lateral and medial epicondylitis, arthroses, and postherpetic neuralgia. Efficacy rates range, however, from around 60% to 90%, depending on the researcher, the protocol, and the criteria used, but an average of around 80% improvement in approximately 84% of patients seems to be the agreed norm. Let's just pause there for a second.
Wow.
That is a huge amount of success for something that is non-drug and non-invasive and completely comfortable.
Right.
An 80% reduction in pain for 84% of patients.
And we're talking almost 20 years ago.
Right. Yeah, it's just stellar. And that's just, basically turning it on, pointing it at what hurts.
Yeah.
That's the baseline that you work from. I would say that I do see numbers about like that in practice with people who have good quality laser devices and who have at least a little bit of an idea on what they're doing with it. So, if you're looking into laser therapy as a possible add-on modality for your clinic, for your patients, these are good numbers. These are really good numbers to have pretty rapid, very safe, very effective pain relief for a wide variety of symptoms. Right. I mean, you might have a protocol with your manual therapy or chiropractic or your exercise therapy strategies for frozen shoulder. But what are you going to do for post-herpetic neuralgia? You're not going to adjust it.
No.
You're not going to exercise it.
No.
So what are you going to do? You've got to have something else in your toolbox if you're going to help these patients in a non-invasive, non-drug way. Mm-hmm. And certainly being less invasive and being less drug-focused is fantastic when it works.
With no side effects.
With no side effects.
That's a key there, too.
For sure.
So
he goes on to say that pain is really only one of the facets treated with laser therapy. Others include essential hypertension, hyperpigmentation and hypopigmentation, wound healing, bone repair, nerve repair, scar revision in suitable keloids, hypertrophic and depressed scars, and control of involuntary tonic spasms. Not just pain.
That's amazing.
I know. Yeah, and this was back in 2005, right? So this is not a new idea.
No, and we've actually seen very good success, like you mentioned earlier.
Yeah.
With all of those.
Yeah, we have. And in many cases, it's almost a byproduct of something else we're working on. Mm-hmm. Working on somebody's neck pain, and we watch your blood pressure drop from chronically elevated to completely normal.
Yeah.
So there's definitely good effects beyond what we would expect.
Right.
From simple pain relief. So this present paper, he says, presents my own technique based on over 25 years experience in treating over 48,000 patients with laser therapy for the entire range of applications listed. I call it the proximal priority technique, or PPT, and the treatment techniques are based on the anatomical considerations of the neural, blood, and lymphatic vascular systems, working from proximal, which would be the brain and its blood supply, to distal, the area of interest, right? So he's talking about really trying to stimulate the central nervous system, the vascular system, in the core of the body before you go down to treat that sprained finger or that epicondylitis, the tennis elbow, or the knee pain from arthritis.
And what would be the reason for that? Why would you start, neurologically, basically, and when my pain is down in my wrist or my thumb?
That's a very good question. That is what basically every patient says before we go and do something like this. Well, my spine isn't my issue. I'm not worried about that.
It hurts.
Yeah, it hurts down here. Why are you going to work on my spine? Well, in truth, there is much more you can do with the laser than simply reducing pain signals. That's definitely something you can do, especially in the really high dose lasers. You can do this with a class 3 laser, even if you're right on the nerve. But with class 4 laser, it's extremely easy to basically overwhelm that nerve and provide a pain blockade. Now, that's only kind of a temporary effect, but the effects of light therapy go much, much deeper than that. And in terms of opening up more blood supply and stimulating nervous system functions, this is exactly what he's talking about doing. He's talking about stimulating the blood flow and the nervous system prior to working on anything pain-related, because if you have a stimulated nervous system and increased vasculature, you're going to have more and deeper neurological changes while you're trying to address that pain condition, which means you will be faster with your results, and it will last more completely.
So in a sense, it kickstarts your whole system.
Exactly.
To stimulate repair.
Exactly.
And then you can focus in on the area that needs it.
Right.
So
with chronic pain, there are neurological changes that we can see in the lab where if something is in pain for a long time, the brain starts to change the way it handles the nerve that goes to that section. So if you just treat the painful area, you're ignoring everything else that has gone on with this pain syndrome. And that's what this doctor's talking about, is trying to address this at a deeper level. So let's talk about how he uses that. What is his proximal priority technique?
Yeah.
So what he does with this is he delivers a dose of 30 joules per centimeter squared at each point of interest, which is a fairly high dose. Using a class 3 laser, he's doing about 10 seconds per very, very tiny point, very high intensity, about 3,000 milliwatts per centimeter squared, which is a fairly high intensity. Do realize this is a very low power laser, though. It's only 60 milliwatts. So you still don't really get any warming effects. It's just a tiny spot. But overall, a lot of energy goes into each spot that he does. And to start with these different individual spots, he says, treatment is always started bilaterally on the sides of the neck, about 2 centimeters below the ears, targeting the blood supply to the brain to increase cerebral blood supply and hence oxygenation. The spinal aspect at the base of the skull is next targeted at the atlas axis junction, C1, C2 junction. He says, for this reason, I call this part of the proximal priority technique the C1, C2 zone. The patient is asked to extend the dorsal aspect of the neck by lowering the head anteriorly. Now, why would we want to do that?
Open up that area.
Absolutely. How did you have that answer so fast, Christy? How did you...
It's the technique we use.
It is. And have for a long time.
Ask the patient to tuck their chin so that we can access that area more fully.
Absolutely. So those points are irradiated in what he calls dorsal root therapy as well, which is out working on where the nerves actually kind of come out of the spine, the dorsal root ganglion. He says, and then subsequent points, approximately 1 centimeter apart, are irradiated, working anteriorly to the final point just by the stylomastoid foramen behind the ear. Right in here. Now realize, he's talking about using a tiny, tiny laser spot size. So he's doing these individual spots.
And he's holding
and
it.
He's holding it for 10 seconds, exactly. He's holding it in place. But he's covering, really, all of this section here that is suboccipital upper cervical area, right? He's using a laser that is fairly high intensity in its very tiny spot size. He's doing 30 joules per centimeter squared, and he's doing quite a bit of area for it being such a low power laser. So it does take quite a bit of time.
I was just going to say that would take quite a bit of time with such a small spot size.
Right.
And so
since 2005, we've had much more powerful lasers come in that now you could do a treatment like this where you cover all of this zone in about 15, 20, 30 seconds if you want to. And then you're not worried about where you're moving per point. You just cover all of it. You just
cover all of that.
Right.
So it's more efficient.
It's very efficient. And it's less technical. If you've got a laser tech performing this, you basically just train them on how to treat that suboccipital area, make sure the patient's got their head tucked, right? And then and getting into all these spots, below the ear. This is very, very simple. And then you're stimulating all these targets that he goes on to talk about, like the dorsal root ganglion, the brainstem itself. And that's really the point here, is to stimulate these structures before you then get distal. He says, no matter what I am treating or wherever the area of interest is, I always start with the bilateral neck and C1, C2 zone treatments. Always, no matter what he's treating.
See, and that makes sense. Just what we've talked about up to this point. But how would you explain to the patient, wait a minute, again, why are you treating my neck when I need my foot or my ankle or even my low back? Why are you on my neck?
Right. Yeah, that's a great question. Now, if you're a chiropractor, you've probably already had to explain this before. When the patient goes, well, it only hurts in this one spot. Why are you adjusting next to it too? Well, because we know we have referred pain syndromes and spinal dysfunction that can affect multiple areas. And so this is the same idea. You're working on these core structures, these central nervous system structures that actually play a role in the entire body. And if you ignore the central and you only work on the peripheral, you're going to miss out on some of the benefit you could provide. Now, he says that he does this with every single patient. I've found over the years that when you're using class 4 lasers at least, you don't always have to do this to get good results.
And, I can understand that just from my history and my, we've targeted a full systemic, or we've done a full systemic treatment. And then also the targeted area.
Right.
Or let's just do the systemic and not the targeted area.
Right.
Because sometimes you just need the body to balance itself.
That's exactly right.
Is that kind of where he's there here?
Yeah. Yeah. And setting up a thing like always do this is going to have limitations. There's always going to be some patients that should not have that. But generally, I think it's important to come away with the impression that it's a good idea to try to stimulate the central nervous system with most disorders.
Right.
And that's the great thing with lasers. You can safely stimulate nerve centers in the brain, vasculature, without any risks or any side effects, anything like that. So this is certainly something to pay attention to. So he's done the neck. He's done the C1, C2 area. He's worked kind of really this whole section here. The first couple inches, really, of the upper neck.
Now it's bilateral. It's not just one side.
Exactly. Yeah, and he likes to do bilateral. He says, I generally then use a dermatomal-based approach. First applying laser to the intervertebral points on the side, the same side as the region of interest. So if we have, say, an elbow problem on this right side, he's treating that whole bilateral upper neck, but then he's also going to whatever dermatome would be sourced from that particular dorsal root ganglion, right? So it's that nerve root. He treats the nerve root before going down to the area that is involved with it. Finally, I treat the region of interest itself. So he does all this stuff, works over multiple nerve roots, and then gets down and does multiple points with the small laser on the actual painful area.
Okay.
He says, in the case of chronic pain, the patient is advised strongly that pain will probably increase in that region of interest as it comes out of its chronic phase back into an acute phase and from there to alleviation. This is called retracing because you don't start with chronic pain. Right? It starts with an injury or something happens in an acute phase, then the repair processes fail for whatever reason, the inflammatory condition carries on instead of resolving, and now you're left with chronic pain, or the nerves are so traumatized that they just continue to carry the signals even when there's nothing else, there's no real cause for them to do that. We expect that to feel different, and in some cases, worse initially before it gets better. And so this is a very good point for anybody doing any kind of work with chronic pain. You should be aware that in a lot of cases, the pain will get different and sometimes worse before it really starts to alleviate. And that's not a bad thing.
No.
So just be aware of that. It's nice to see it pointed out by an expert like this. It really is.
Right.
So that's the proximal priority technique. There's a lot more information about kind of the rationale behind it here that I won't go into. You should definitely, if you're interested, pick this up and read it. It's 5 pages. It won't take you very, very long. He's a great writer. But the idea ultimately behind this is, yes, we want to stimulate more blood flow to the brain and the spine, and we want to stimulate the nerves before they ever even get close to this injured area. So there's a lot of nerve-related disorders in particular that I have seen this play out and be very true. So carpal tunnel syndrome.
Right.
I hate to admit it, but I failed horribly at the first few carpal tunnel syndromes that we tried to treat with laser, myself and another doctor. None of it worked. It started working amazingly well once I developed some techniques to follow the nerve from where it starts in the neck down to that carpal tunnel. It doesn't take long, but it is an essential part of getting that carpal tunnel syndrome to reverse.
Because you're probably just treating the area that hurt.
Oh yeah, you think about
this is where it hurts.
Yeah, it hurts in my wrist, it hurts in my fingers. Treat this.
But then, like you said, you have found some technique that follows that nerve to help it. And it just makes sense.
It does.
It just makes sense.
Yeah, it does. And there's other disorders, of course, like peripheral neuropathy. You're gonna really miss out if you don't treat those nerve roots. From where they start. If you don't follow the nerve in some cases. If you don't treat the symptomatic area sometimes. So there's certainly even chronic pain disorders, stuff that's been around for a long time, it involves the nervous system. So you have to treat the nervous system as a part of resolving that chronic pain issue. It doesn't mean you don't treat the scar tissue, the inflamed area if there is one. It doesn't mean you ignore it.
Right.
But you need to get the nervous system on board if you want to see that resolve and actually improve and last. So at this point, looking at what he's talking about here, there's, this is a time-consuming process. We have a lot of advantages now that Class 4 lasers are available and are at very, very useful place in their development here. Number one, this process is quite fast. If you want to replicate this process, it really doesn't take very long at all. And secondly, you can account for some of the inaccuracies or anatomic variants that go on by not being so worried about a tiny laser applicator. With a Class 4 laser, you can cover a very large area. And so, I think about this because I see this with ultrasound frequently. You'll have anatomy that's supposed to be somewhere that is a little bit different than it is for the average person. Going back to carpal tunnel syndrome, you can have the median nerve travel in a slightly different area or have some entrapment or actually have a bifid median nerve that splits its way through that. And if you're using a very tiny Class 3 laser applicator, you don't have to be off much and you're going to completely miss that nerve.
Right.
Class 4 laser has a huge output piece in most cases, which means it's a lot harder to miss those anatomic variants that you might not know are there.
Right. Well, and if people want to know more about spot size and, that sort of thing, we can tell them about other podcasts that have been delivered. Yes. And, there's a plethora of information out there.
There is a ton of information on just our podcast alone as far as spot size, wavelength, power density, power in general. And I think it's worth saying that, if we know that these kind of techniques work with the small Class 3 lasers, Class 4 lasers operating on the same principle should deliver good results a little bit faster.
Right.
And a little bit simpler.
A little simpler,
Yep.
faster. And you don't have to, like you're saying, be laser on.
Right.
Laser focused in that area. You can just, because it covers the whole.
Covers a huge area all at once. So if you do have an anatomic variant, or if you as the doctor or the tech is just a little bit off from where you should be, you're still covering enough area that you're not missing anything,
Well, and the blood flow and the circulation is going to help just that whole area anyway.
Absolutely. Absolutely. There's a couple of interesting photographs, actually, that were captured for this study that talk about penetration, because this doc does talk about, actually using 830 nanometer light to get through the tissues. And you can see in this picture how much light is coming through the wrist there. This is an infrared camera capture. How much light comes through the wrist at 100 milliwatts compared to 40 milliwatts. And obviously there's a significant difference in terms of how much light comes through. But, even low power lasers can certainly get light through the tissues when it's the right wavelength. 800 to about 1100 seems to be really pretty good. And clearly, in this case, it's pretty obvious to see the higher you go in power, the more light you're going to transmit through those tissues as well. But not just soft tissues, but also bone. So this is another infrared capture of putting laser on bone and watching it transmit, or he says transilluminate, these bone specimens. So you got iliac crest there, you've got the vertebral body itself, and you can see how much of that bony tissue is actually lighted up by these very low power lasers. So, getting light through the skin and to the bone, you can actually have that travel. And especially flat bones here, the iliac crest, you can see it carries tons of light. But also, the skull is another type of flat bone. So carrying light through the skull itself can be quite powerful, which is why we know that some of the transcranial laser therapy can work just incredibly well, because light does travel through tissues. Light does travel through and along bone. And it's pretty obvious when you can see it on the camera.
Right. That's pretty incredible. It's just amazing.
Yeah. So if you're listening to this and thinking, boy, I really could use some help on how to use my laser in this manner, pick up this paper, take a look at it, read it, and see what you can pull from it. Again, it's almost 20 years old, but it still really presents a lot of great ideas. And if interpreting this paper is something that you're just not confident in, get a hold of us, because we have trained hundreds of practitioners on how to use Class 4 lasers in this manner, in a way that works well, with settings that work well, and that get patients great relief, great results. And we typically see higher success rates than the average is said here. We typically see, about a 90% relief in more than 90% of patients, usually closer to 95% of patients. There's a whole method to that to make sure you get that kind of result, those kinds of results. It does involve a good bit of learning, but we put it all together for you in easy to access online format,
right?
In a way that makes sense, and then we support you along the way. So if you want to learn more about using your laser this way, you need to get a hold of us, lasertherapyinstitute.org, or you can email us directly, info@lasertherapyinstitute.org.
Yes. Fascinating study.
It's cool stuff. There's so many papers out there too that are just really interesting, and we're never going to get through all of them. There's several hundred published every year, but we try and bring some really exciting ones in, and in a manner that hopefully you can benefit from hearing about them. So thanks for joining us.
Thanks.